Good morning. Today we'll be talking about achieving universal health coverage. And with us, we have some special guests who will be really breaking it down for us. Thank you, Dr. Alawode and Mrs. Aduku, for coming on the program with us. It's indeed a pleasure to have you here. Can you tell us, Dr. Alawode, if we start off with you, can you break it down to us in very simple terms? What is universal health coverage? Why is it important? Why should Nigerians know about it?
Okay, thank you very much. Thanks for having me. And thanks for asking that very important question about what is universal health coverage. Universal health coverage means that everybody, irrespective of their situation, whether they are poor, rich, male, female, urban or rural areas, respective of their tribes or ethnicity, they're able to have access to needed healthcare of good quality and with financial protection so that they are not uh, thrown into poverty in the process of seeking health care. This is extremely important because universal health coverage has several imperatives. Of course, it has health imperative, ensuring that we're able to get the needed health care. Everybody knows that health is wealth. Without health, if we have health, we can think of any other thing. If you don't have health, we can only think about health. So health is a very, very crucial. It's wealth. And again, beyond health imperative, it has a economic imperative as well. It's only people that are healthy that can contribute to the economy, that can work, that can pay tax, and so on and so forth. And part of the economic imperative is that countries which have made progress on universal health coverage it creates jobs as well. In some countries, there are a lot of people working in the health space. And in the UK, for instance, the NHS in the UK has one of the largest workforce in the whole world. So if you're able to make progress towards universal health coverage, we're going to create jobs because along the health value chain, a lot of people are involved. Producing drugs, working health facility, working health administration, a lot of opportunities as well. And don't forget that one of the main reasons why people go into poverty is because they have to take care of their health bill. Without any
Mm.
form of financial protection, a lot of people will throw into poverty. Data has it that more than 100 million people actually throw into poverty globally every year because they have to pay for health bill. So if we really want to be serious about, tackling poverty, we have to look at the health issues as well. So the issue of a universal health coverage is not health is very, very important, but it's not go beyond health. Look at the economy, look at the issue of poverty, look at job creation and many other imperatives as well. And that is why we really have to attach importance to universal health coverage.
Okay, so how far has Nigeria progressed in the achievement of UHC? I mean, what are the major gaps? We're not there yet, obviously. So what are the gaps?
So there are a number of gaps in terms of in the area of so just like any market, there's a supply and demand aspect of it. So in the health sector, there is a supply issue and demand issues as well. So supply in terms of do we have adequate number of facilities? If we have facilities, are they well equipped? With the requisite personnel that we need. We have the drugs, and what is the quality of care being provided? Don't forget, quality is part of the definition of universal health coverage. And again, in situation where services are even being produced, what is the capacity, financial capacity of the people to be able to pay for these services without financial hardship, because that is extremely important. It's not only just about paying for it. So how do we ensure that people pay without financial hardship? There are a number of mechanisms which we call financial protection mechanism, like health insurance, government paying for health. Only very few people are covered by such a financial protection. So that is the problem. That is why a lot of people are not able to have access to the needed care when they need it. But let us forget sociocultural barriers as well. There are instances where uh, believe around, oh, I'm suffering from this illness, but it is not hospital matter. Some people say, okay, this illness is not hospital matter. I have to
Yeah,
go to the
yeah.
prayer house. I have to go to traditional, traditionalists to be able to access it. I think those are some of the problems in terms of both the supply and demand side. Of course, there are examples of a very good intervention by the government. We just have to work together to scale those interventions.
No, you've actually already touched on some of these, but from your experience, both as a medical doctor and as a proponent for UHC, what are the biggest challenges the patient, the man on the ground, the person listening to this program face in actually accessing affordable and quality healthcare in Nigeria?
So to me, the number one is the cost of care. Is the cost of care. It's not everybody know how expensive things are, especially in the last 1 year. Especially those people that have to deal with a chronic disease. Somebody was talking about a sachet of one of the common causes for the drugs for diabetes, like which is they call it glucophage, used to cost 2,000 early last year. Now it's 8,000 naira. Somebody have to be on these commodities, on these drugs every day. We did analysis recently, and it shows that it costs nothing less than 900,000 in a year to be able to manage simple diabetes without complication. And again, analysis shows that the poorest of the poor in Nigeria, their average income per year is not more than 120,000. So put 120,000 as an average income side by side with of course, it's obvious that the cost of accessing care is a huge problem. And it's not only about diabetes, even the common malaria, the issue of diagnostics and everything. So without a financial protection mechanism that covers everybody and covers everybody well, it's going to be very, very difficult to be able to access drugs. So we'll be left with a situation where it is only the rich people that can access care that actually getting this care. And one of the fundamental things we are looking at in universal coverage is equity. Everybody, irrespective of your situation, it should be because the truth of the matter is that nobody is immune to sickness. So everybody, and another factor is that illnesses are not predictable in terms of somebody says you can predict when your child will go to school. You can say by September, I'm preparing for it. And nobody can predict when he's going to fall ill. So, and that is why we need a sort of mechanism, health insurance. I appeal that the health insurance expert are in the room where everybody should be covered and irrespective of when illness
we'll talk to them about that.
Yes.
But what I'd also like you to talk about, is there a role for collaboration between the public and private sectors in advancing universal health coverage in Nigeria? Because for me, that's a very pertinent one, considering my role as the president of the Healthcare Federation.
This is a very important question because one, for a couple of reasons. One, Nigeria tend to have a very robust private sector landscape. I want to say private sector, a number of them who are involved, those that are providing the care, and those that are involved in other things in diagnosis as well, those that are involved in like a health maintenance organization, very, very robust, including pharmaceuticals. So there is a very robust private landscape. And in some situations, people tend to access care more in the private facility than in the public facility. For a number of reasons, the private facilities tend to be there almost 24 hours. The access to them is very easy and all those stuff like that. So it's extremely important for us to have a very strong framework for partnership between the public sector and the private sector. And the part of the framework for partnership, don't forget that public sector is had the responsibility of regulating the system. So if you are not, if the regulator is not actually working with the private sector, this work is going to be the sources of such a regulatory work. So we need that partnership. And then part of the partnership we are talking about is part of the private sector is the private philanthropists that are bringing resources. Don't forget a lot of organizations have what do you call where they set aside certain part of their resources,
CSR.
corporate social responsibility, exactly,
Yeah.
corporate social responsibility. But where partnership is actually needed is that a bank, for example, sets aside certain money as part of corporate social responsibility. Without partnership, they might tend to spend the money on the area that are actually less needed or the area that others have been spending, and there'll be a lot of uh, poor coordination of resources and we'll be wasting resources. So we need partnership in many fronts with the private sector to be able to ensure that we're able to harness the resources of the private sector. Don't forget, private sector being the business people, they tend to be more efficient and very, very proficient in the way they manage resources. So we need all those to harness all these resources and at the end of the day to ensure we have a better regulatory platform. We're able to bring innovation. We're able to bring research. We're able to bring digitalization of the system if we partner effectively with the private sector. Over.
Oh, wow. Thank you so much. I think that's very key. I think there's a lot that can be benefited from. For example, the taking over or the concessioning of primary healthcare centers to private entities has been shown to be very successful, for example, in Delta State. And so more of those kinds of things can also be possible with that kind of integration and collaboration with government. So thank you very much. Thank you, Mrs. Aduku, for being on the program. It's a pleasure to have you once again with us.
Thank you for having me, and it's a pleasure to be here once again.
So can you tell us, how does health insurance contribute to achieving universal health coverage, particularly in Nigeria?
Okay, thank you for the question. I mean, Dr. Alawode has shed a lot of light on, universal health coverage. And as the name implies, for the universal, I mean, it's all encompassing. It covers everyone, irrespective of race or tribe or anything of the sorts. But I believe truly that health insurance remains essential for achieving universal health coverage. What is health insurance? It still remains the financial mechanism to protect people. From statistics, it shows truly that every Nigerian is just one step away from poverty based on any kind of ailment that can befall them at any point in time. As we're aware, I mean, ailments don't come knocking on your door saying, be ready. So it has to be something that, you have a protection against. So for having the health insurance, it really, reduces that financial burden on the individual. By pooling resources, we are able to get a mass number of people who are able to, make payments in terms of premiums. And that resource, ensures that truly there's timely access to medical service whenever you need it. It also improves service quality because you're able to use that funding mechanism to improve infrastructure, even in the healthcare space, and then, of course, strengthen the overall healthcare systems. So, we believe that it's a key tool in advancing universal health coverage in Nigeria. But again, we know that in terms of, penetration has been very low in Nigeria. Less than 5% of people are covered in terms of health insurance. And what we've seen is there is so much out-of-pocket payment.
Can I stop you there?
Sure.
Because this is critical. Okay, so we know that health insurance covers care. And people know that. Most people know that. They have insurance for cars, they're aware of what insurance does. And most people are paying out of pocket for care. So why are not more people taking up insurance? Why aren't they doing that? What's the problem?
There
are there barriers?
Yes, there are. And some of them have been mentioned. The social-cultural barriers, for instance, have been mentioned. But again, there still remains a general lack of awareness around health insurance and how it works, most especially. Because there's that lack of awareness, there are not a lot of people uptaking it. We also have issues, of course, around the cost. People feel that, oh, this thing might be very expensive because they have to pay either annually or biannually, or, but those social cultural, barriers still remain. You go further up country, really, people are still holding on to, oh, it's not my portion, for instance, So these are things that have created, this, barrier for people not to be able to take on health insurance as they should. But I think that it's important that health insurance is also made voluntary. Where it has worked in other countries, to be honest, it has been a voluntary, uptake of health insurance. That is what has helped to push health insurance in a lot of countries. And I see us going in that direction, especially with the National Health Insurance Act that was passed into law in 2022. So now if health insurance becomes compulsory, just as it is in other climes, we believe that the uptake can increase. It will be a lot better. People would have to take insurance. And that is what would help, to push for a larger uptake across, the country. But we've seen this work in other climes like this. So we believe that that's the way to go. It's a step in the right direction. I mean, coverage UHC has been slow, but we believe that, with this, what has happened, we think that this would help to increase uptake of health insurance across the country going forward.
Okay. Now, can I ask, is the health insurance, is it the same in the urban and rural areas? Because already, we have a challenge in rural areas with them being underserved, etc. And of course, with their financials, you can't earn as much in the rural areas as you can in the urban areas. One of the questions we have here is your organization working to make health insurance more affordable and accessible to informal workers and to rural communities? Do you have any programs like that?
Yes, we do. We understand that, of course, we have to push this agenda as much as possible. So, I mean, we have microinsurance products, which are bite-sized and can enable people purchase, within the limits of what their pocket dictates. We have those products. But we also work in partnership with communities to be able to provide these kind of health insurance products as well. For health insurance, I mean, distribution remains a major issue. So why not go through associations, through community-based, schemes or churches, to be able to push that agenda for societies and communities to take up these kind of insurance plans that even cover just the basics around, of course, malaria, accident and emergency, and even some form of preventive wellness where we go for outreaches, So we partner with bodies and other associations to be able to push for, this to happen, because we understand that truly equity, as Dr. Alawode spoke about, is very important in achieving universal health coverage. So that's one of the things we try to push as much as possible at Bastion Health. But we do have a lot of partnerships to be able to push this agenda far and across from the urban areas into the rural areas as well. And we're also open to working with NGOs, a lot of NGOs, to be able to push for awareness around this in some of these communities.
How can we ensure? Yes, how can we ensure that vulnerable populations such as women, children, and the elderly are prioritized under UHC? I mean, recently our minister spoke about pre-cesarean sections for our women. These are obviously very important with the high maternal mortality rate that we have in the country. But how do we ensure this kind of prioritization?
So again, it's also around collaboration, but I believe that even with the National Health Insurance Act, there's what is called the Vulnerable Group Fund, where there's a mechanism to put aside, some funds in place for these vulnerable groups around, women, children as well, to be able to ensure that their own health needs are met. So that is also, speaking to equity. Ensuring this happens is also working with the private sector as well, to ensure that these tax mechanisms work and we're made aware of them to be able to push the agenda of the federal government as well in ensuring that that vulnerable group fund is funded at every point in time, just to ensure that basic healthcare is met across these kinds of, people who we term vulnerable, like the women, the children, and, that kind of category of people who would not be able to ordinarily purchase a plan, based on, of course, even their financial status. But these are things we believe also in working with the government and the policies that are in place will ensure that truly everyone has access to healthcare at any point in time, wherever they are.
If I can just ask, Dr. Alawode, going back to you, what role does technology play in bridging the gap in health access and achieving universal health coverage in Nigeria?
Okay, thank you very much. I think technology is very useful in bridging gap between people that have access and they don't have access. For example, telemedicine is going to be very, very crucial in ensuring that people in rural area, people that may not be able to have access to specialized care, are able to do it to the extent that now people not even have access to care to provider from, offshore because of the use of telemedicine and other technologies. There are other technologies available that can help us to improve quality of care, access, and improving the efficiency of service. So technology is going to be very, very crucial. We have to be more intentional in terms of how we use technology.
Thank you very much. And Mrs. Aduku, what are your thoughts? How does technology help with health insurance?
Technology enables us break down infrastructural barriers. I think that's the first thing. And then second, from that, it reduces cost, the administrative cost, of course, eliminating the cost of travel. So it just bridges those gaps in terms of bringing it nearer. And it's even much more affordable than having to, really go out and buy or pay out of pockets, in the comforts of your home. So I think for me, that's really what it does. It breaks down those infrastructural barriers and cost.
Fantastic. So unfortunately, time is fast spent. We just have a few minutes left. So can I ask, do you have any last words for our listeners, Mrs. Aduku, before I go to Dr. Alawode?
Yes. So
in particular, I'd like you to just address what message would you like to share with Nigerians on their role in the journey towards achieving UHC, each individual you're speaking to out there?
Honestly, to achieve universal health coverage in Nigeria, it's a collective effort and requires the active participation of every Nigerian. So individuals should embrace health insurance as a means of protecting, of course, themselves and their families from the financial burden that, your health scares can bring. And this would also ensure access to quality and build more resilient healthcare systems. So it's a collective effort for me, and I think all of us should embark on that journey together.
Thank you. Dr. Alawode, your last words.
So thank you very much. I think for us to make progress in the journey of universal health coverage, we need a mindset shift on the part of the government and at the same time on the part of the populace as well. I think the populace should try as much as possible to see health as a right and to use every opportunity to hold government accountable for its responsibility towards it. But at the same time, the various community to ensure that we pay attention to health infrastructure, to take ownership of our institution, and to hold everybody accountable. And on the part of the government, to know that health is not just health imperative, it's an economic and political imperative as well.
Thank you. Thank you very much.
Thank you for watching. Please like, share, and subscribe for new video updates.